Thank you for choosing Cedars-Sinai Medical Center for the upcoming birth of your baby. Whether this is your first or last delivery, we know that a little information ahead of time can reduce stress. So we've created a brief tour to help you know what to expect from your arrival to your discharge from the hospital. When you arrive at the medical center, we suggest that you park closest to the North Tower. Generally, P1 is the closest parking lot, but you can also valet your car at the South Tower street level, and if needed, a wheelchair can be provided to bring you to the third floor. If your discomfort is such that you will need assistance, you may wish to park at the emergency room, and they will take you directly to the third floor labor and delivery unit. Once you arrive on the third floor, please proceed to the labor and delivery unit window and check in. We ask that all patients complete their pre-registration paperwork by week 22 so that we can easily get you registered and admitted to a room upon your arrival. The pre-admission form can be found online at our website, www.csmc.org/OBGYN, by clicking on For Patients. The form can be faxed to Labor and Delivery Pre-Admissions at 310-423-0104, or it can be mailed to Cedars-Sinai Medical Center, L&D Admissions Office, 8700 Beverly Boulevard, Los Angeles, California, 90048. The admission staff will verify your official identification with your registration information to ensure your account is accurate and processed timely. If during your pregnancy you develop complications or need to be monitored on an inpatient basis, your obstetrician might admit you to the MFCU, or Maternal Fetal Care Unit, for closer observation. Cedars-Sinai has the largest inpatient MFCU in Southern California, and we specialize in caring for mothers with pregnancy-related complications. If you go into normal labor or are a planned induction of labor, you will check in at the labor and delivery window. From here, a nurse will take you to your labor room where you will be evaluated by your nurse, physician, or certified nurse midwife. Together, a care plan will be developed to safely care for you and your baby. If you are having a planned C-section, you will still check in at the labor and delivery unit window where you will be escorted to a labor room where the preoperative care begins for your C-section delivery. After your vaginal delivery, you and your baby will recover together in your LDR room. Likewise, after your cesarean delivery, you will be taken to a quiet, peaceful post-anesthesia unit so a nurse can monitor your recovery. We prefer to keep mother and baby together throughout the recovery period, providing both are stable. This allows for some quiet family bonding time. From recovery, the new family will be taken to their postpartum room. Once you settle in, we encourage and support you in keeping your baby with you at your bedside. If you or your baby need special attention, we can take your newborn to the nursery. If you have any other needs during this time, such as pain medication, please be sure to ask your mother-baby nurse. During your stay, you will be visited by your child's pediatrician and a lactation consultant. If at any time you have questions or concerns about your care here, please do not hesitate to contact one of the nurse managers on duty that day by calling the nurse's station. The optimal length of stay varies for each mother and baby, and the amount of time you are in the hospital is individualized. Your stay should be long enough to be sure that mother and baby are doing well. Please be sure to discuss this with your doctors. Your mother-baby nurse will provide you with education and hands-on practice on how to care for yourself and your new baby in the days to come. Discharge instructions will be provided, and we will work to ensure you feel prepared to handle things once you are at home. Of course, your healthcare team, made up of your nurses, certified nurse midwife, obstetrician, and your baby's pediatrician, welcome your calls in the event you get home and have questions or concerns. Prior to discharge, we recommend that your partner bring your car seat up to your room to fit the straps to your newborn, and then return it to your car in preparation for bringing baby down. Because the state requires certification for car seat fitting, our nursing staff will not be able to assist you with this. At discharge, you may want to have your partner make a first trip to the car with all of your luggage and gifts. At that time, they can temporarily park in South Tower at the street level. Then they can accompany you as you and your baby are taken by wheelchair to the parking area. We hope you found this short video helpful. We look forward to making this a positive experience for you and your family.